Hello, my name is Evelyn Duran Fernandez. My topic is about vitamin D supplementation and prevention of type 2 diabetes. Definition: the effects of vitamin D on type 2 diabetes can be driven by multiple mechanisms. For example, studies have found that the pancreas contains receptors for D-hydroxyvitamin car active vitamin D metabolism 1.25, which is required for the synthesis and secretion insulin by pancreatic beta cells. Most studies showing positive management of type 2 diabetes by supplementation of vitamin D have claimed that the vitamins help maintain a normal glycemic status by reducing insulin resistance, the main causative factor for diabetes.
We know that low levels of vitamin D can increase the risk of porous bones. Now, new research shows low vitamin D can also increase the risk of type 2 diabetes. Registered dietitian Nancy Dell has those details in tonight's Food for Thought.
It is important for those of us who live in New England to be aware of the possible connection between low vitamin D levels and type 2 diabetes, since we are likely to develop low vitamin D in the winter months. Our bodies make vitamin D when the sun hits our skin, but from November to April, the angle of the sun's rays is such that we do not make vitamin D. New research on 680 women shows vitamin D helps blood sugar leave the blood and enter our cells where it's used for energy. In the study, women who took vitamin D supplements or had sun exposure had lower blood sugars than those women who did not take supplements or get sun exposure. So be sure your doctor checks your vitamin D level and gets you to a healthy range. It just may help reduce your risk of developing type 2 diabetes.
Application in nursing. When the healthcare gains sense of the possibility of vitamin deficiency, there is the possibility of performing a simple diagnostic test. The test only consists of the carrying out of blood tests at the request of the corresponding physician. Such test is designed for the patient 20. The test either consists of performing a serum study of the blood concentration of 25 OHD.
A research institute in Hyattsville is now part of a large-scale clinical trial to see whether a vitamin D supplement can help prevent or delay type 2 diabetes. Jennifer Donnellan has our report on this Diabetes Alert Day.
Hi, Mr. Green. How are you?
Gregorio Green has a family history of diabetes and is at risk for type 2 diabetes himself.
I already have hypertension, and diabetes is just adding fuel to the fire, so to speak.
He's not giving up, though. Instead, he signed on to a study at MedStar Health Research Institute with hopes of upping his chances of avoiding diabetes altogether. While the typical adult intake of vitamin D is 600 to 800 units a day, the study will have patients take a daily dose of 4,000 units. Past research suggests more vitamin D might reduce diabetes risk by 25%.
The worst thing it could do is help. So here I am.
86 million adults in the U.S. may be at high risk for diabetes, while increased vitamin D could help stop people from getting the disease. Without a large clinical trial, medical investigators won't know for sure.
And we put on specific criteria for a patient who are pre-diabetic.
So now 2,500 people at 20 study sites across the nation will take the increased supplement for 4 years.
If we're able to confirm that vitamin D does actually help with the prevention of diabetes, this will be a significant public health implication in the United States.
Okay, that is cause for hope. Now, they are still seeking participants for the study. You can go to WJLA.com for more information on that. We're back here.
Pros and cons. Pros. Vitamin D can reduce the risk of the obesity in two ways. It can regulate appetite by increasing the level of blood lectins, which is required to control fat storage and induce satiety. On the other hand, it can reduce the blood level of thyroid hormone, which in the long term can trigger mechanisms of weight loss. Cons. There are also some side effects of vitamin D related to managed diabetes. For example, studies have shown the mining of optimal level of vitamin D in the long term is associated with weight loss and the decreased rise of obesity, which lower the risk of the diabetes.
Some interesting news tonight about a common vitamin that may help slow or even prevent type 2 diabetes.
It's vitamin D, well known for its role in helping make strong bones. Dr. Max Gomez is here now, though, to tell us about a new study says it may also keep diabetes at bay. Doctor.
That's right, guys. And type 2 diabetes is by far the most common type. 30 million people in the U.S. have it. Type 2 diabetics make insulin, but their bodies aren't responding to it. And eventually the insulin-producing cells are exhausted and blood sugar goes up. That's where some people think vitamin D can help. You don't have to search for long on social media to find people touting the benefits of vitamin D in diabetes.
5,000 to 8,000 IUs of vitamin D every day. You might be able to actually minimize your risk.
While its benefit is far from proven, there are reasons to believe that vitamin D could help with type 2 diabetes.
There is epidemiological evidence that it's associated with deficiency or at least low levels of vitamin D in blood. So there have been a number of studies asking the question, does vitamin D supplementation prevent or reduce the risk of developing type 2 diabetes?
And that's what a new study in the prestigious journal Cell is working out. What is the possible molecular mechanism for vitamin D's benefit in type 2 diabetes? Researchers used insulin-producing beta cells made from stem cells and found that vitamin D interacts with genes in the nucleus in a way that reduces inflammation in a lab dish and in mice.
If you then supplement human beings at risk for diabetes, that it would reduce their risk of beta cell failure, beta cell inflammation, and a progression to full-blown diabetes in people at risk.
Dr. Andrew Stewart directs the Diabetes, Obesity, and Metabolism Institute at Mount Sinai and says that while making beta cells more resistant to inflammation might stave off diabetes, it remains to be shown in humans. That's the goal of a major NIH study giving people at high risk for type 2 diabetes vitamin D supplements. Results are expected early next year. Now, many experts
Issue applies in Ecuador. In Ecuador, a recent study carried out in the already population has described the prevalence of vitamin D insufficiencies and deficiencies, despite the abundant natural light throughout the year. This condition varies considerably between different regions and areas of our country. The prevalence of vitamin D deficiency or insufficiency patients with type 2 and also depends on the threshold used to define it. In our studies, vitamin D insufficiency was defined at vitamin D level 30 ng/ml.
Many people don't have enough vitamin D in their bodies. A low vitamin D level can cause bone disease, rickets in children, and osteomalacia and bone pain in adults. And it turns out that low vitamin D can increase a person's risk for many common diseases. An adequate vitamin D level lowers a person's risk of type 2 diabetes. Adequate vitamin D levels may help lower blood pressure and help the immune system to function well. An adequate vitamin D level is associated with better muscle strength and a lower risk of falls. And there's evidence that having adequate vitamin D levels lowers a person's risk of colon cancer, breast cancer, and prostate cancer. There aren't many foods that are a naturally good source of vitamin D. There are foods that have been fortified with vitamin D: milk, orange juice, cottage cheese, and fortified cereals, for example. Our bodies can make vitamin D if our skin is exposed to sunlight, but most of us don't get enough sunlight to make adequate vitamin D for our bodies. And the terminology of vitamin D levels and metabolism can be quite confusing. You'll hear doctors talk about vitamin D2, vitamin D3, use words like cholecalciferol, ergocalciferol, and even more confusing words like 25-hydroxy vitamin D and dihydro-125 vitamin D. For those who would like to know the details of vitamin D actions and metabolism and who'd like to evaluate the evidence for vitamin D's preventive effects, I've included a citation for a New England Journal of Medicine article on the end title, and the article can be ordered on the internet. The details of vitamin D metabolism and its actions are fascinating, but you don't have to know them to benefit from vitamin D therapy. The current recommendations for vitamin D supplementation are too low, most experts agree. Most people should take a daily dose of 800 to 1,000 units of vitamin D3. But you shouldn't take more than that without a doctor's recommendation, because too much vitamin D could cause problems. But too much vitamin D in the body is very rare. You can find out your vitamin D level by ordering an online test for vitamin D. The test to order is a 25-hydroxy vitamin D level, and it costs about $50. The optimal range for 25-hydroxy vitamin D blood level is 30 to 60 nanograms per milliliter. But you don't really need the blood test. All you really need to do is to take the 1,000 units of vitamin D3 every day. You may feel better. You will lower your risk of cancer, improve your immune system, improve your muscle strength, and lower your risk of falls.
Conclusion. Although low levels of vitamin D have previously been associated with an increased rise in developing type 2 diabetes, some studies have not reported improvement in metabolic function. However, these often have low numbers of participants or included individuals with normal levels of vitamin D at the baseline who had healthy metabolism or long-term type 2 diabetes. So, is vitamin D supplementation has any beneficial effect in patients with prediabetes or newly diagnosed diabetes, especially those with vitamin levels?
Could vitamin D be the next breakthrough in preventing diabetes? Dr. Adeline Ghazi, she's an endocrinologist with the MedStar Good Samaritan Hospital, here to join us. Thank you. Talk about this topic.
Thank you for having me here. As you all know, tomorrow is Diabetes Alert Day, and according to our most recent statistics from the Center for Disease Control, more and more people have diabetes, and more people are at increased risk of diabetes, which is a very serious disease. Currently, about 29 million people, or adult Americans, have diabetes, which is 3 million more than what it was in 2011.
Diet related, you think?
It's a combination. It's partly genetics. So if you have family history, that's a risk factor, but also, of course, diet, exercise, all that weighs in. It's not just one factor.
Talk to me about this vitamin D in this study.
So this is very interesting, actually. There's recent research that shows that vitamin D can work in different mechanisms in the body to lower the blood sugar, regulate the blood sugar. It could improve our body's response to the insulin that we produce by reducing inflammation, for example. It can also even perhaps help us produce more insulin. So this study has been done in animals, and it's been shown that vitamin D is actually playing a role in blood sugar control.
So we're looking at clinical trials in this point?
So yes, so because the information that we have is mainly animal studies, and it's also studies that show that people who have low vitamin D levels are more likely to develop diabetes. We're trying to see if actually giving them vitamin D can help prevent that. And this is a clinical trial. Is called D2D study. We are MedStar Health Research Institute. We're one of over 20 clinical sites in the country. that is undergoing this trial. We're trying to involve 2,400 participants who are at increased risk of diabetes, or in other words, have pre-diabetes. We're trying to see if giving them vitamin D at a dose that's a little bit higher than what you would normally buy over the counter can help prevent diabetes down the line. And it's a study that's going to go over the next 4 years, and it's going to help generate this really important information.
Okay.